How to heal blisters. Blisters can occur from repetitive activity or friction, such as running while wearing ill-fitting shoes. You may also get a blister from a sunburn or other type of burn. To heal a blister, protect the blistered area and try some natural remedies. You may need to drain the blister if it is large or painful. With careful first aid, you can successfully heal most blisters. Method 1. Protecting the blistered area. 1. Leave the blister alone if it has not popped and you can endure the pain. It is better to avoid exposure to bacteria by letting the blister heal naturally without trying to pop it. If you feel like you must drain the blister, read the medical warnings and instructions below. 2. Soak the affected area in warm water. One method is to simply soak the affected area. Use a clean bowl or sink and fill it with enough warm water to cover the area, your foot or hand, for example. Soak for 15 minutes. The warm water will soften the skin at the top of the blister, which can help the blister drain on its own. 3. Cushion the affected area with moleskin. If your blister is in a spot that receives pressure, such as the bottom of the foot, you might want to cushion the area with a piece of moleskin. Moleskin is a soft cotton fabric, typically with an adhesive backing. This will relieve some discomfort. It can also help protect the blister. Cut a piece of moleskin a little bigger than your blister. Cut away the center so that it fits around the blister like a donut. Stick this to the blister. You can also try other adhesives like blister, band and elasticin. 4. Let your blister breathe. For most blisters, especially smaller ones, exposure to air will help the healing process. Give your blister some air. If the blister is on your foot, take care not to let dirt get on the blister. You may need to wait until bedtime before you uncover your blister. Let the affected area air out overnight while you're sleeping. Method 2. Using natural remedies. 1. Apply aloe vera gel. Aloe vera has many healing properties, helping to reduce pain and inflammation. Use aloe vera gel on your blister to help it heal more quickly. Apply to your blister and cover it with a bandage. You can use gel straight from the plant itself, or you can purchase aloe gel in a natural food store. 2. Soak the blister in apple cider vinegar. Apple cider vinegar has antibacterial properties and can help a blister heal more quickly. Make a paste of apple cider vinegar and castor oil by mixing a half cup of vinegar with 3 teaspoons of castor oil. Apply this mixture to your blister a few times per day. Cover your blister with a bandage. 3. Try tea tree oil. Tea tree oil has antibacterial properties and also works as an astringent. Soak a cotton ball or piece of gauze in tea tree oil. Gently apply this to your blister. Cover the blister with a piece of gauze and adhesive tape. 4. Use a green tea bag on the blister. Green tea has antibacterial properties and contains tannic acid that helps harden skin. When you harden the skin at a blister site that has begun to heal, a callus may form and your skin won't be as prone to blisters in that area. Soak a green tea bag in water for a few minutes. Squeeze it gently to remove excess water. Lay the tea bag on the affected area for several minutes. Method 3. Draining a blister. 1. Determine if you should drain the blister. If your blister is large, painful, or is getting irritated, you may decide to drain the fluid out of it. It's always better to leave the blister alone, but you may find that relieving the pressure from the blister will help reduce pain and irritation. Don't drain the blister if you have diabetes, HIV, cancer, or other conditions that make you susceptible to infection. 2. Wash your hands. Use plenty of soap and warm water to wash your hands. You don't want to introduce any additional bacteria or dirt to your blister while you're draining it. 3. Clean a needle or pin with rubbing alcohol. You'll need a sharp object to puncture the blister. Ensure that it is clean by wiping the needle or pin with a piece of gauze soaked in rubbing alcohol. 4. Puncture the blister near the edge. Choose a spot on the blister near the edge. Gently push the needle or pin into the blister. When you see fluid start to emerge, remove the needle. You may want to puncture more than one spot on the blister, especially if it is a big blister. This may help relieve pressure that builds up in the blister. 5. Clean and bandage the area. Wipe away excess fluid with a clean piece of gauze. When there is no more excess fluid draining from the blister, gently clean the blister with soap and water. Cover your blister with a piece of gauze and adhesive tape. You may want to use some antibiotic cream on the blister for the first day or two. If your blister starts to itch or develop a rash, stop using the cream. If there is a flap of skin from the blister, don't trim it. Leave it alone, letting it lay flat over the blister. Clean and bandage the area every day. If the area gets wet, change your bandage. Let the area breathe at night by removing the bandage. Replace the bandage in the morning if the blister still needs to heal. This will help protect it from getting dirt into it. 6. Do not drain a blister if you have a serious health condition. People with certain conditions such as diabetes can be at higher risk of developing infections from blisters. If you have diabetes, HIV, cancer, or heart disease, do not drain your blister. Instead, see your doctor for treatment. 7. Watch for signs of infection. It's possible that your blister may get infected. If you see any signs of infection, make an appointment to see your doctor immediately. Some signs of infection include increased swelling or pain at the blister site, increased redness at the blister, skin is warm at and around the blister, red streaks that extend from the blister and outwards, yellowish or greenish pus coming from the blister, a fever. Method for preventing blisters. 1. Choose your socks carefully. Many people get blisters because their socks rub against their feet. Runners are especially prone to this problem. Avoid cotton socks, which absorb moisture and are more likely to cause blisters. Instead, choose nylon or wicking socks, which do not absorb moisture. These are more breathable and will help protect your feet. 2. Buy shoes that fit well. Many blisters are caused by shoes that don't fit properly, especially shoes that are too small. You may find that your shoe size can vary a half size in one day. Try on shoes when your feet are most swollen during the day to ensure that the shoes will be big enough to comfortably fit your feet. 3. Use moleskin as a preventative measure. Moleskin can be used to cushion and protect a blister, and you can also use it to prevent blisters if you are prone to them. Cut a small piece of moleskin and stick it to your shoe or foot at the spot where you may start to get a blister. 4. Use talcum powder in your socks. Reduce friction on your feet by using talcum powder. This will help soak up moisture that may otherwise cause blisters. Sprinkle a bit of talcum powder inside your socks before putting them on. 5. Avoid contact with blister-causing plants. Certain plants, such as sumac and poison ivy, can give you blister rashes. If you need to handle these types of plants, Take precautions by wearing gloves, long pants, long-sleeved shirt and shoes. Warnings. Take care to watch for signs of infection. If you notice the blister getting more painful or swollen, or you have a fever, vomiting, or diarrhea, see your doctor immediately. If you have recurrent blisters, you should be evaluated for bullous disease and/or genetic disorders that lead to blistering.